USAID has always been a great supporter of family planning program. We can vouch for it right from the last 2 decades. This is something, a very strong partnership, and we really value your support. So over to you, Amit, for your comments.
Thank you. Good afternoon, everyone. So dignitaries on the dais, off the dais. Am I audible? So it is indeed a privilege to represent USAID here at this important National Family Planning Summit. Let me start off with a quick quiz, a question, and would request for a show of hands. So this is the third National Family Planning Summit since 2012, since the London Summit happened. 2013 Eros, a lot of people must remember. 2016 when injectable was announced, and 22 is where in the shadow of the pandemic we are all over here. So how many people have attended all three summits? There is a prize at the end of it. So not okay, great. So for all of you, post lunch there is a photo op with Dr. Sikdar and unlimited access to contraception from the National Family Planning Program till the time the next summit happens. So on a personal note, this invite is very, very special. It's been a 10-year-long journey since the London summit. So many familiar faces over here: Jyoti, Poonamji, Kirti, Archana, Medha, Deepa, Ram, Anand over here, and all the ARC members. And as Dr. Sikdar always used to say, we are co-conspirators. But we debated, we had so many differences of opinion. But what made it so very special was at the very end, we always reached a consensus. When the National FP 2020 Action Plan used to be developed annually, we always had a consensus. So that's what made it very, very special. I truly find the theme of the summit for today very apt for the National Family Planning Program. Sabka Saath, Sabka Vishwas, Sabka Prayas and Sabka Vikas. Having worked very closely with the Ministry, all technical and policy divisions, and especially with Dr. Sikdar and his stellar rockstar family planning team, I can state on record that the National Family Planning Program has definitely translated this vision into practice. The agenda and the diverse stakeholders who have assembled here today, if you look at the range of civil society organizations, development partners, professional medical associations, healthcare providers, young people, we have program managers from the states, policy makers. I think that itself is the reflection of the spirit of partnership and commitment of everyone to support the National Family Planning Program. For all of us working on this common agenda, this event today offers an opportunity to comprehensively review the progress, but also chart the way forward. And I assure you that I will use the 10 minutes that have been allotted to me very judiciously. So the organizers were worried. They thought I am going to narrate the 70-year partnership of USAID with the FP program. So I'll just restrict for the 10-year journey. In the first 5 minutes, I'll just talk about the few highlights of the 10-year journey, and then also lay out certain priorities for the future. So in 2012, when the global FP 2020 movement was launched, all eyes were in India, and rightly so, because if the global goals were to be achieved, the ambitious goals, then India had to deliver. So in India, even prior to the summit, there was a very unique grassroots civil society led organizations which had all come together to even shape the agenda for the London summit. After that, this was followed by an unprecedented exercise of data driven and evidence based action plans, wherein each district of the country developed a very detailed action plan, taking care of the local context, the demand supply challenges, the local stakeholders, and the data was at the core of it. So Martin Smith is over here with us today, and he can attest to the fact that the district level action planning that was done was definitely a template that even other countries were very curious to know about how that national plan was translated into district level action. These evidence-based action plans which were done at the district level, and also the National Family Planning 2020 action plan that was done on an annual basis with the support of all partner organizations, really set the tone of the journey for the last 10 years, and which was again furthered by several new initiatives that were launched by the government, and the progress is there, the results are there for everyone to see. At USAID, we feel that we are indeed very, very fortunate that we had the opportunity to support the National Family Planning Program and several states through a range of our projects and implementing partner organizations, and also working close collaboration with the FP 2020 core group, UNFPA, Gates Foundation, Packard Foundation, and other civil society organizations. I would just briefly highlight top 5 highlights of a 10-year journey. The first and foremost is a focus on evidence and data for decision making. We supported the various rounds of the National Family Health Survey that remains the gold standard for data on fertility and demographics. And to add further value, we launched the unique Rasta initiative to use the NFHS data to conduct secondary research to support the family planning program by addressing the bottlenecks and even coming with actionable items. This initiative has resulted in more and more young Indian professionals getting engaged in the family planning agenda and also strengthening the regional institutions, local Indian regional institutions for conducting high quality family planning research which can only benefit the policies and programs in years to come. The second one is on the expansion of contraceptive options in the country. Whether it was injectable contraception or progesterone only pills or Centroman, USAID has been a partner to the ministry when it has come to expanding the basket of contraceptions in country, and we continue to work closely with all the other development partners to identify further opportunities to expand the basket. The third area is private sector engagement. This has been an important part of our strategy, and through our projects we have demonstrated several newer approaches, whether it is digital technology solutions or workplace interventions, PPP models, unique partnerships such as the Condom Alliance or even an SRH helpline. We have recently launched UDAN, a collaborative that brings together various private sector partners to increase access to SRH information, products and services by young people and address the market inefficiencies for family planning. The fourth one is the focus on younger cohort of population. This was a conscious choice. Bearing in mind the changing demographic, we, through our programming, tried to ensure that adolescents and young people are empowered to make appropriate SRH choices. We were a proud partner of the 10 to 19 Adolescent Collaborative, which involved multiple funding agencies and cross-sectoral programming to holistically address SRH, the felt needs of adolescents, ranging from education, livelihoods, life skills, agency, and of course SRH. We even supported a youth survey on what do young people want and have recently launched a youth-focused campaign, Baatein Unlocked, that engages young people in conversations around their health and well-being. Last but not the least is the emphasis on integrated programming and partnerships. As part of the ministry's integrated RMNCHA program, we were able to focus on enhancing the uptake of voluntary family planning products and services, using the continuum of care and life cycle approach across all the higher priority districts that were assigned to USAID as lead development partner. This effort continues through the Ayushman Bharat Health and Wellness Center program, the Aspirational Districts Initiative, the RKSK program, the School and Health and Wellness Initiative, and all these initiatives actually involve partnerships across all levels of the healthcare delivery ecosystem and also with all the partner organizations. A lot of progress has been made in the country in terms of FP indicators, and I will not delve deep into the data or the various initiatives that this has already been addressed by the previous speakers. I would just like to highlight the fact that if the upward trajectory must be maintained and universal coverage of reproductive health services in India has to indeed become a reality, then a lot more needs to be done. The COVID-19 pandemic has exposed several fault lines in the healthcare delivery system. It has challenged several fundamental assumptions on health-seeking behavior and even on how healthcare should be provisioned. However, it has opened several new opportunities as well. So newer partnerships coming to the fore, a very unique spirit of collectivism, community action, the importance of self-care, direct-to-consumer channels. In addition, the Government of India has launched several integrated healthcare initiatives which have been matched by significant budgetary allocations, whether it is the 15th Finance Commission or PM Abhi. There is strong political will also to transform the health sector and so on and so forth. So the opportunities are immense. It is imperative on all of us now on how we capitalize on these opportunities and identify newer approaches to address the unmet need of contraception in the country and truly make it a 21st century program. Taking a closer look at the successes and challenges reveals that on one hand there has been a substantial increase in eligible couples in need of contraception from 66 to 76%. However, the actual demand satisfied shows only marginal improvement from 72% to 74%. There are nearly 50 million eligible couples that are still in need of modern contraception. How do we ensure that our national program is able to cater to their needs and bridge the gap? There are several such questions. How do we ensure that we are able to address the geographic inequities? How do we ensure that our programs are tailor-made, looking into the specific context of even reaching out to the northeastern states? How do we ensure that with the increased urbanization that is happening, how does our program gear up to cater to the needs of the urban poor? How do we ensure that we reduce the demographic inequities or the gender inequities as well? For USAID, inclusive development remains at the core of our programming. We constantly strive to ensure that our programs reach out to the most vulnerable populations. We have launched several key initiatives that address issues of child early and forced marriages, teenage pregnancies, and gender-based violence. As India moves forward with a new vision of attaining universal health coverage, there is a need to build on the existing evidence, just catalyze fresh ideas and work collectively. I would just like to end, 8 seconds. I would just like to end by committing on behalf of USAID, हमारा साथ, हमारा विश्वास, हमारा प्रयास और देश का विकास, which we truly believe will enable India to showcase its learnings to the world and become a global leader. Thank you all for patient hearing.
Thank you, Amit, and thanks for the slogan coming from Amit Shah, Dr. Amit Shah. So this is very timely slogan, and I don't want to reel out all the things that you said because, as you said, we are